we sat down with Pamela Merritt from Reproaction and Candace Bond-Theriault from the National LGBTQ Task Force to discuss how providers can best support communities. And what structural barriers are there to reproductive health care?
So I started a volunteer project with a couple of friends of mine in which we would go into transitional shelters. And these shelters existed for homeless women who were either pregnant or who had recently given birth. I started to realize, listening to them, what infant and maternal mortality looks like in real terms, the names behind it, how terrified many of these women were of childbirth because they knew somebody who had died or who had had a catastrophic birth outcome. I definitely realized what it's like to be told that because you're pregnant, you're going to be covered from your neck down to your waist. But the second you give birth, you're only covered, with the very basics through Medicaid. How debasing the social service programs were, how insulting they were, and how they treated people like they had somehow failed because they were poor. How we view poverty as the wages of sin, even though there's a million reasons why poverty is happening in St. Louis City. And most importantly, what wonderful, amazing mothers these women were, and how very deliberate and careful they were about their children as they worked, went to school, and came to my class exhausted and participated and focused.
Why is there mistrust between the healthcare system and providers?
There's just a lot of mistrust, I think, between people of color, queer and trans folks, and medical providers, just because of all of the lack of knowledge that people are displaying and the experimentation, right? And in the name of science, quote unquote science, is super harmful. And I don't think that has ever been reconciled. I think as a person of color, I'm still waiting for that ability to really be able to trust in my physician wholeheartedly. I'm from DC, where the maternal mortality crisis is super high and unreasonably high, and for no reason except for a racial bias, right? So how am I going to put trust in a physician who's supposed to deliver my child, knowing that this is a thing and knowing that there's so much harm out there? I wouldn't even want to go through that system, right? I want to find the midwife down the street. And how unavailable that is, and how stigmatized that is, and how stigmatized even, home birthing is.
I think understanding the history and also understanding how that history gets passed down. So my mother's family is from rural Mississippi, and they left during the Great Migration after World War II to go to Pennsylvania. But my mother was born in the home that she was raised in Mississippi. Her mother had been born in the home that she was raised in. And the idea of going to a hospital was just bizarre. My mother was terrified when she had my brother and was going to a hospital because the rule was that you didn't, because they would take away your ability to have children. And they did in Mississippi. I have family members who were sterilized without their knowledge in Mississippi. So that's a reality. It's important for providers to understand that in my family, that might be something that goes back to 1945, but in other people's family, that goes back to the 80s, because this country did that up until the 80s, and then there's already news about forced sterilization in prisons that is current. So when you're talking to people about their reproductive health options, understanding that history and understanding how you're giving them and why you're giving them advice is very important.